So here is our update on food-related research for the month of May 2025. And we have a lot of different studies to look at. So the first is that exercise and fruit will improve mental well-being of those with diabetes type 2. They've also said that consuming white meat and dairy can also help. What they've not really specified is the ratios. There's no problem with eating food as long as it's actually food and not a food product, but we have to consider that dairy, meat, they do come with fat in them. They don't contain the micronutrients we need to run our regular body functions. They're full of protein and fat, which in small amounts can actually be good because you do need B12 and animals can be a source for that. Another study is a review of 9 different randomized controlled trials, so 899 patients who all go on to a whole food plant-based diet, and they have decrease in pain from their osteoarthritis, they have better function and overall weight loss just by doing this whole food plant-based diet. Here's a bit of a controversial study now. We're looking at breast milk for babies. We know this is the best source, but there are conditions where moms can't give milk to their own baby, or they have to give a supplementation. Supplementation is often artificial things that don't really come as close to what the mother can make for their baby. So what they've done is they've compared breast milk to supplements versus supplements with a postbiotic. And they've gone to look at how the gut microbiome in the baby is based on its feces, and they go on to say that postbiotic added milk is better than breast milk. I'm not sure if I really agree with this, and the surrogate marker they've used may not be reflective, but many times postbiotics get destroyed in the stomach. So how is it really making a difference? It's hard to say, but this is what their research has shown us. We have another study from China looking at 21,403 students, and they look to see if they have caries in their teeth or not cavities, right? So about 40% do, and they find that those who do either go to boarding schools or from a rural area. They might consume a lot of sugar-sweetened beverages. They may be eating a lot of fresh fruit, a little dubious there, but they may not be doing too much toothbrushing, or they sleep irregularly and prolonged hours, meaning they may not have time to brush their teeth. So these are logical reasons why people in this age group would have caries. Another controversial study that's kind of reflective of the times is semaglutide versus fasting. So we know intermittent fasting can help a person reduce their body fat, reduce their overall fats, and get themselves into a better lipid profile. But when you have drugs like semaglutide, why would you want to? You can continue eating whatever junk you like and have the semaglutide process it for you so you don't get it. And what they see is the trend now when people are educated in intermittent fasting versus having a pill, they choose the pill. They would rather have their poison and enjoy it than adapt lifestyle modifications that could be helpful for the rest of their life. Another different study is looking at more of food insecurity. So can a person get regular whole food plant-based meals, or are they dependent on irregular handouts that are food products? When this is the case, food insecurity leads to decreased resilience and more mental stress. And of course, those who do have more physical activity have better resilience. So take it for what it is, but these are very particular populations that I'm looking at. An interesting study is something we already know: high glycemic diet, so things rich in carbohydrates and sugars, will make acne vulgaris worse, and reducing this will control that. Another interesting study that's controversial is we're looking at whole food plant-based diets and orthorexia nervosa. Now what they're saying is people who adapt these vegan whole food plant-based diets, what they do is they are trying to fit a particular body image where they fit into a particular BMI, often a healthy BMI, but they could take it too far and become malnourished. And what this study says is that those who adopt these kind of dietary modifications, what some people call a restricted diet, these people end up with orthorexia nervosa, and they say that from their previous studies they've seen a lot of this. Now, what drives all that is a concern, but what they're trying to get at also doesn't make sense, because if a person is overweight, these kind of diets are very good. If they're underweight, they could afford to have a little more fat and possibly healthy fats. The last one is a reaffirmation that a healthy plant-based diet can reduce breast cancer. And that's updates for food this month.